Hi, my name is Debby Farkas. I'm the Director of Educational Development at WISER. Today I'm speaking with Dr. Neal Benedict, Associate Professor of Pharmacy and Therapeutics at the University of Pittsburgh, Critical Care Pharmacist at UPMC. Thank you for taking the time to speak with me today.
Oh, thanks for having me.
My pleasure. Your Pharmacy Student Readiness Assessment course incorporated novel ways to assess students. Can you please tell me where the idea for the course came from?
Sure. 2 years ago, I was asked by my dean to put together a group of faculty to improve our students' patient care skills, a very general task. What we realized when we convened our group, is that if we were going to move the bar forward, we had to first completely understand where our students were at the time. We didn't think we had a really good idea. So the idea of a progress test became very appealing to us. Progress test being a test that is administered multiple times, and these are equivalent assessments administered throughout the curriculum. So therefore our early learners, our P1 learners, will get the same assessment then as our P3 learners.
Okay.
In that way, then we can monitor progress throughout the curriculum. Next is, what are we going to assess? How are we going to move the bar? What is the bar? So for that, we interviewed our faculty and we surveyed our preceptors. And we asked them, what can our postgraduate trainees, so our residents, what can they do that our students struggle with, or some can't do at all? So what are those outcomes, those patient care skills that we want to assess? And what came back from the faculty mirrored what is in the educational outcomes for our profession. And that's that clinical decision making, so that proficiency of care, the attitudes of ownership, so that professional covenant, and the interprofessionalism and the ability to integrate into it in a team to make decisions and make recommendations. Step 3 then was, how are we going to assess those 3 things? We want to keep the progress test. How are we going to assess clinical decision making? How are we going to assess attitudes of ownership for patient outcomes and interprofessionalism? We knew right away that multiple choice wasn't going to cut it. And so simulation was an easy answer for us. We do a lot of simulation throughout our curriculum, whether it be virtual patients, standardized colleagues. We knew this mannequin model simulation, so we knew that simulation then has worked for us and would work for us in assessing these outcomes. Step 4 then became this putting them together, this blended simulation progress test. And we thought this test would be valuable, number 1, to our curriculum. It would help drive curricular modifications and curricular advancements. Number 2, it would be extremely important for our school. Our new accreditation standards ask that we, as faculty, that we are assessing clinical readiness for practice. And this readiness assessment will go a long way into showing our accreditors that this is how the University of Pittsburgh does it. So very valuable to our school. And then most importantly, extremely valuable for our students. For our early learners, our P1s we call them, our first year learners, this assessment sets the culture of the entire curriculum. It shows the learner that this is what we want you to be able to do when you leave here. And then for our more upperclassmen, our more senior learners, like our P3 learners, for them it's a gauge, it's a barometer on their strengths and then their areas of improvement regarding patient care and patient care skills. And this assessment then provides them with some recommendations on how they can improve their patient care skills.